piles of newspapers that haven't been read in years, rooms so filled with possessions that they can no longer be used for their intended purpose, narrow pathways winding through stacks of items that others might consider worthless. These are the visible manifestations of hoarding disorder, a complex mental health condition that affects approximately 2 to 6% of the population worldwide. But behind the clutter lies a profound struggle that is often misunderstood and stigmatized. Today, we'll explore hoarding disorder, not as a lifestyle choice or simple messiness, but as a serious condition with neurobiological underpinnings that causes significant distress and impairment. Defining hoarding disorder. Hoarding disorder is characterized by persistent difficulty discarding or parting with possessions, regardless of their actual value. This difficulty stems from a perceived need to save items and distress associated with discarding them. The accumulation of possessions constricts living spaces and significantly compromises their intended use. What distinguishes hoarding from collecting or simply being messy is the level of dysfunction. Living spaces become unusable, health and safety risks emerge, and daily functioning becomes severely impaired. While popular media often focuses on extreme cases, hoarding disorder exists on a spectrum of severity. For some, just one room might be affected. For others, entire homes become uninhabitable. The condition typically develops gradually, often beginning in adolescence with symptoms progressively worsening with age if left untreated. By middle age, symptoms can become debilitating without intervention. The psychology behind hoarding. Understanding hoarding disorder requires looking beyond the possessions to the underlying psychological processes. People who hoard often experience intense emotional attachments to possessions that others would consider ordinary or worthless. Items become imbued with significant meaning, representing security, opportunities, memories, or even extensions of identity. Discarding such items feels like losing a part of oneself or erasing a memory forever. Information processing differences play a crucial role. Research reveals that people with hoarding disorder often experience executive functioning challenges, including difficulty with decision-making, categorization, organization, and attention. These cognitive patterns make sorting and discarding items overwhelming. Additionally, many exhibit acquisition avoidance, fearing they'll need something in the future and experience regret if they've discarded it. Perfectionism paradoxically contributes to hoarding behaviors. Many individuals with this disorder fear making the wrong decision about what to keep or discard, leading to decision paralysis. Items are saved until the perfect decision can be made, which often never arrives. This perfectionism extends to finding the perfect use or recipient for items, making disposal nearly impossible. Beyond stuff, types of hoarding. While physical objects represent the most recognized form of hoarding, the condition manifests in diverse ways. Digital hoarding involves accumulating electronic files, emails, or digital photos beyond any reasonable use, often filling multiple hard drives or cloud storage to capacity. Animal hoarding involves keeping an excessive number of animals without providing adequate nutrition, sanitation, or veterinary care, despite deteriorating conditions. Thought hoarding, a less visible manifestation, involves the excessive collection and rumination over thoughts, ideas, or mental lists. This cognitive hoarding creates mental clutter that can be as debilitating as physical clutter. Understanding these diverse presentations helps broaden our conception of the disorder beyond stereotypical images. The neurobiology of hoarding. Advances in neuroscience have revealed distinct neurobiological patterns in hoarding disorder. Brain imaging studies show differences in activity in regions responsible for decision-making, attachment, and emotional regulation, particularly the anterior cingulate cortex and prefrontal regions. These differences aren't simply consequences of hoarding but appear to represent underlying vulnerability factors. Genetic research provides further evidence of biological underpinnings, with hoarding behaviors showing heritability rates of approximately 50%. Hoarding often runs in families, suggesting genetic predisposition, though environmental factors clearly influence whether and how severely symptoms manifest. These neurobiological findings highlight that hoarding isn't simply a behavioral choice, but has roots in brain function and structure. Common triggers and progression. While genetic predisposition creates vulnerability, specific experiences often trigger or exacerbate hoarding behaviors. Traumatic events, particularly those involving loss or deprivation, can intensify saving behaviors as a form of emotional self-protection. The death of a loved one may trigger saving of their possessions as a way of maintaining connection. Material deprivation in childhood sometimes leads to compensatory accumulation in adulthood. Major life transitions, retirement, divorce, children leaving home, frequently coincide with worsening symptoms. These periods of change and identity disruption can intensify attachment to possessions as anchors of stability. Understanding these triggers helps explain why hoarding often worsens during particularly vulnerable life periods. The hidden impact. The consequences of hoarding disorder extend far beyond cluttered spaces. Health impacts include increased risk of falls, fire hazards, poor nutrition, medication mismanagement, and difficulty accessing medical care. Respiratory problems from dust, mold, and poor air circulation are common. In severe cases, basic hygiene becomes challenging when bathrooms or kitchens become unusable. The social impact is equally devastating. Shame leads to social withdrawal as individuals become reluctant to invite others into their homes. Family relationships suffer tremendous strain, with conflicts about the clutter often becoming the dominant family dynamic. Children in hoarding households may experience developmental impacts, including limited space for play, difficulty having friends visit, and sometimes removal by child protective services in severe cases. Financial consequences accumulate as well: property damage, rental evictions, storage unit costs, and decreased property values create significant economic burden. Many experience employment difficulties as the mental preoccupation with possessions and time spent acquiring or organizing items interferes with work performance. Insight and awareness. A particularly challenging aspect of hoarding disorder involves varying levels of insight. Unlike some mental health conditions, many individuals with hoarding behaviors don't recognize their behavior as problematic, viewing interventions as unwanted intrusions rather than helpful treatment. This limited awareness creates significant barriers to treatment engagement. Others have awareness that fluctuates, recognizing the problem intellectually but struggling emotionally to change behaviors. A smaller percentage have clear insight but feel helpless to overcome the powerful urges to acquire and save. Treatment approaches must be tailored to these varying levels of awareness, with motivational interviewing techniques often necessary before actual hoarding interventions can begin. Evidence-based treatment approaches. Effectively treating hoarding disorder typically requires specialized approaches rather than standard clinical methods. Cognitive behavioral therapy specifically adapted for hoarding has shown the most promising results. This approach addresses the thoughts and beliefs surrounding possessions, gradually builds skills for sorting and discarding, reduces acquiring behaviors, and improves organization abilities. This specialized treatment usually involves in-home sessions where therapists can provide hands-on assistance with sorting and discarding in the actual environment where hoarding occurs. Treatment typically lasts longer than for many other conditions, often 6 to 12 months, reflecting the deeply entrenched nature of hoarding behaviors. Medication, particularly selective serotonin reuptake inhibitors, SSRIs, shows modest benefits for some individuals, especially when hoarding co-occurs with depression or other anxiety disorders. However, medication alone rarely resolves hoarding symptoms without accompanying behavioral interventions. Community-based approaches. Given the complexity of hoarding disorder and its impact on communities, multidisciplinary approaches have emerged as best practices. These collaborative teams might include mental health professionals, social services, public health departments, housing authorities, and first responders. Such approaches recognize that hoarding often requires addressing both psychological needs and practical challenges like code violations or eviction risks. Harm reduction strategies, focusing on safety and functionality rather than perfect clearance, often prove more sustainable than forced cleanouts. Research consistently shows that without addressing underlying causes, forced cleanouts nearly always result in recurrence of hoarding behaviors, often with increased distress and treatment resistance. Supporting loved ones. For family members and friends of people who hoard, the condition presents unique challenges. Attempts to help by discarding items without permission typically backfire, damaging trust and increasing saving behaviors. Confrontational approaches or ultimatums rarely motivate sustainable change. Instead, supportive strategies focus on maintaining connection, expressing concern about safety rather than criticizing clutter, and understanding the genuine distress that discarding causes. Family therapy can help repair strained relationships and establish healthier patterns of interaction beyond the focus on possessions. Support groups for family members provide valuable validation and practical strategies from others experiencing similar challenges. Recovery and realistic goals. Recovery from hoarding disorder looks different than for many other conditions. Complete elimination of all saving tendencies may not be realistic for many individuals. Instead, successful treatment typically focuses on significant reduction in clutter, restored functionality of living spaces, reduced acquiring, improved decision-making skills, and better quality of life. Progress often follows a nonlinear path, with setbacks and periods of faster improvement. Many individuals benefit from ongoing support even after initial treatment, either through booster therapy sessions or support groups. Understanding recovery as a journey rather than a destination helps maintain motivation through inevitable challenges. Changing the narrative. Perhaps the greatest obstacle to addressing hoarding disorder effectively is the profound stigma surrounding it. Sensationalistic media portrayals have contributed to misconceptions that hoarding represents moral failing, laziness, or simple defiance. These mischaracterizations prevent people from seeking help and contribute to community responses that focus on punishment rather than support. Education represents a powerful tool for changing this narrative. Understanding hoarding as a mental health condition with neurobiological underpinnings helps shift responses from judgment to compassion. Recognizing that no one chooses to live with the distress and impairment of hoarding disorder opens doors to more effective interventions. Conclusion. Hoarding disorder represents a complex condition at the intersection of neurobiology, psychology, and environment. Behind the visible clutter lies genuine suffering that deserves compassionate understanding and effective treatment. With growing research, specialized interventions, and changing attitudes, there's hope for those affected by this challenging condition. By moving beyond simplistic explanations and punitive approaches, we can help individuals reclaim not just their physical spaces, but their lives and connections to others.